The importance of having your horse's chiropractor be a veterinarian and the veterinarian be a chiropractor is the foundation of Dr. Mitch Lowrey's veterinary practice. Equine sports medicine and chiropractic care was founded by Dr. Mitch Lowrey to provide treatment and prevention of specific lameness issues, as well as the overall well-being and maintenance of performance horses. Dr. Mitch takes a whole horse approach when tackling lameness issues or enhancing a horse's overall performance by utilizing a wide array of both traditional and non-traditional treatment modalities. Equine sports medicine and chiropractic care provides services that include lameness evaluations, pre-purchase exams, joint and tendon treatments, stem cell therapy, digital radiography, ultrasonography, endoscopy, chiropractic, acupuncture, game ready, and applied kinesiology. Dr. Mitch strongly believes that a comfortable, pain-free horse will be able to perform at its best. He frequently recognizes behavioral issues as pain response that cannot be trained away. Dr. Mitch's ultimate goal is to prevent lameness from occurring. Dr. Mitch's patient is Pixie, a 9-year-old hunter-jumper pony. Dr. Mitch begins his examination by evaluating Pixie's acupoints while discussing her soundness issues with the client. Dr. Mitch also notes Pixie's posture and overall balance. Pixie presents with a slight head tilt to the right, both on a lead and under saddle. The owner describes short striding on the right front, more predominantly at the trot, as well as difficulty flexing and bending to the right. Pixie has also been fighting the bit and dropping feed while eating, although her teeth have been recently checked. Additionally, while under saddle, Pixie has been observed to have difficulty collecting at all gaits, as well as lacking impulsion. Dr. Mitch begins to motion palpate the entire body as he checks to see where specific subluxations are located. His examination checks for decreased range of motion in each joint and vertebrae using motion palpation from the TMJ all the way to the tail, as well as all 4 limbs. The first adjustment Dr. Mitch makes is Pixie's TMJ. The TMJ is very often overlooked, but a subluxation of the TMJ can be the cause of a multitude of problems, from the head to the shoulder girdle. Pixie's subluxated TMJ could not only have caused her head tilt and bit fighting issues, but could have also caused her to drop feed, as the TMJ is an important part of mastication. Dr. Mitch then goes on to check and adjust the hyoids and recheck the TMJ. Next, Dr. Mitch checks the pony's posterior superior iliac spine, or PI, as well as her intertransverse joints and her sacrum. He then proceeds to her lumbar and thoracic area. Adjustments are made to her right posterior superior iliac spine and the intertransverse joints, as well as her lumbar sacral joint, all of which could have been the cause of Pixie's lack of collection and impulsion under saddle. These areas affect flexion and extension of a horse in motion and require the proper range of motion for a horse to propel from the back end, as well as to be comfortable while in collection. Although somewhat apprehensive of the camera, here you can already begin to see signs of relaxation as Pixie begins to lower her head, soften her eye, and lick and chew. Dr. Mitch then travels to her left side and begins working in the same sequence. Here, Pixie's intertransverse joints are adjusted and her range of motion is again checked. Dr. Mitch then checks Pixie's ribs on each side to make sure they're all in place, which they are. He then travels to her cervical area and begins motion palpation at C6 and works his way up her neck. At C4, he makes an adjustment and then goes back to ensure that there's proper range of motion, and an adjustment is also made at C6. These subluxations in Pixie's cervicals could have very well caused her lack of flexion to the right, as well as her shortened stride on the right front. Dr. Mitch then travels to Pixie's pole, where he begins checking her atlas, axis, and then on to her occiput. Here, he checks Pixie's right limb from her foot upward to her shoulder. Adjustments are made to Pixie's accessory carpal bone, carpus, and shoulder joint. He then goes on to check her scapula. The subluxations of her right limb too could have been the cause of her short striding on the right front, as well as her head tilt and lack of flexion to the right. Dr. Mitch then travels to Pixie's left forelimb and checks each joint in that leg as well. There were no subluxations on this limb, but again you can see Pixie responding to the adjustments by her lowered head carriage as well as the absence of the head tilt she had prior to the adjustment. Dr. Mitch then travels to stand behind Pixie, looking for any asymmetry or any imbalance of a specific anatomical segment. He then begins to check Pixie's right hind limb, starting with the hoof, checking the ankle, hock, and stifle joints. Dr. Mitch begins hip traction, which Pixie clearly enjoys. Once traction is finished, her hip joint is adjusted. Dr. Mitch then goes to Pixie's left hind limb and starts to check each joint and begins traction. Her left hip joint is checked, but no adjustment was necessary. Finally, Dr. Mitch performs tail traction on Pixie, adjusting the coccygeal vertebrae. Once all the adjustments are made, Dr. Mitch then rechecks Pixie's acupoints, and he notes that she is much less reactive than prior to the adjustment. Chiropractic adjustments are more than manipulating joints and correcting subluxations. It's about stimulating the nervous system in a productive and positive way. It should never inflict pain or cause the horse harm, and should never be done in an aggressive manner. As you can see after the adjustment, Pixie is not only standing much more balanced with a lowered, relaxed, straight head, but she also has a softer eye and more relaxed demeanor. Although sometimes there may be some apprehension involved with a horse that's never been seen by a chiropractor, this was clearly an enjoyable experience for Pixie, and should be for any horse when done properly by someone certified in veterinary spinal manipulation therapy or animal chiropractic. Dr. Mitch Lowrey would like to extend a warm thanks to Genevieve Edwards of Echelon Sport Horses in Guyton, Georgia, for the use of her facility in the filming of this video,